One of the best things about getting the opportunity to start up a division within a bigger company is that I got to handpick my staff. And Lois was actually somebody I've worked with previously. I was begging her to leave her old job, and she did, and she finally took the plunge, and I'm so grateful for it. She is one of the best people I've seen working for carers. She has so much empathy, great skill, great problem management, time management, everything that you want from somebody on the ground. We both have experience of living in Turkey. I actually gave birth here, and I also gave birth in Ireland to my first child. And if I'd gone through the Turkish experience first, I never would have had a second child. I was basically alone in a delivery room. They wouldn't let my husband in. I didn't understand what anyone was saying to me. So literally, it's like those dog videos where you hear somebody saying, blah, 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 Fiona, blah, 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 chicken, blah, 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 biscuit. It was like that. I could hear my name. I was getting really paranoid, and it was a really upsetting experience. Whereas even my first birth, where I didn't know what to expect, was actually easier because I had Mikey from the Rotunda in Dublin, who was a great midwife, never forgotten him, and it really makes a difference to have somebody there who could translate everything. I did get the sleeve over here, and I had Lois and other people around me to help me, to translate for me, to tell me what was going on. So every time my name was mentioned, I knew what was going on, and it's amazing how much more relaxed you feel. And it's also having the bit of banter, bit of crack, lots of jokes. So it really is, it makes a totally different experience. I'm sure Lois would agree. We remember so many of our patients. There's so many people that stick out to us.
Oh, definitely. Like lifelong friends. Our patients do really become lifelong friends to us.
And they have such a big impact on us. I'd been thinking about bariatric surgery for myself for years before I got it done. And one of the patient's stories actually pushed me over the edge. I was talking to a woman, she was asking for information about surgery. I was explaining it to her, and she said to me, I asked her, how long have you struggled with your weight? Why are you getting it done? And one of the things she said to me was that her parents had recently passed, and that she was going through pictures of her childhood, of her with her parents. And then she went and found pictures of her kids. She wasn't in any of the photos, and her kids were still reasonably young. And she said that's why she was having the surgery, because she didn't want to be the one standing behind the camera anymore, because she didn't like the way she looked. I had that conversation with her. I went home. I looked through my own phone, my own laptop, all the pictures I have of the kids, and it was the same. Loads of pictures of my kids, loads of pictures of my kids with my husband, but none of me with my kids. And I didn't realise how much I began to loathe the way I looked. There's also health reasons for me. We have a history of heart disease in our family, so yes, there's a risk with any surgery. With gastric sleeve, the risk is usually about similar to gallbladder removal. So it became a thing. My mum died of motor neuron disease, my father passed from heart disease. So when you're going for insurance for your mortgage or anything, they're the first two diseases they ask you about. So really, to reduce the risk, it was time to lose the weight. So it became where the risk was higher, staying obese, or whether to have the surgery and take that risk. So I opted for the surgery, and to be honest, I've never looked back. I'm sure there's lots of people looking at me now going, oh, you could be slimmer. I'm quite happy. I didn't do this for aesthetic reasons alone. I do enjoy the fact that I can go into a shop and buy clothes that I couldn't buy before. But really it was for health reasons, to be able to run up the stairs, to be able to run around with my kids, and to be here longer. And the health aspects of it. I had IBS, I was pre-diabetic. All those issues went away with the surgery. So, and that was literally the impact one of my previous patients had on me.
It is life-changing, the surgery, and the people that you meet through it as well.
And just being able to help people. I don't think there's enough of an aspect on it. We're lucky, we work, it's our job. Let's be honest, it's our job, but we get to work with great job satisfaction. I get to chat to people. I'm a big rugby fan. I don't know whether I know Lois likes some of the rugby players.
Yeah, it's the players, it's not the game for me.
And we get a lot of our New Zealander patients over, and look, you can't knock a man doing the haka at all. So, it's a huge part to chat to them, to talk to them. We're really lucky we get to do something every day that we love.
Yeah, definitely. And just being there for someone, it's such a fulfilling job that I love doing it. I couldn't imagine or see myself doing anything else.
And it's funny, you know, we obviously brought Lois in as our head of carers, you know, and I was kind of like, you can be over the team, you can stay in the office, you don't have to do as much hands-on. And she was like, no. She was like, because the bit I love is actually being with the patients. And I totally get that. Yeah. So she does that. You will meet her, she will chat to you. If you have any issues, she'll be the one to sort it out for you. And surprising, considering how tiny she is, she's a real little battler. So if somebody upsets you in the hospital, she will be the one sorting it out and getting an apology for you.